My topic is roles and responsibility of sponsors. Sponsor is the pillar. Is the pillar of the clinical trial. Is the main pivot role done by the sponsor only. The definition of clinical trial we have discussed much more. So we are awaiting this one. Come to the sponsor. Who is sponsored? Sponsor may be an individual person. Sponsor may be a company, like the pharmaceutical company. It may be institutions like Midnapore Medical College. It may be some organization like some NGO, which takes the responsibility for the initiation and all the responsibility and the management, financing of the clinical trials. So sponsors should implement a system to manage the quality throughout the all stages of the trial process. The sponsor should focus on the trial activities, essentially to ensuring that the human subject protections and the reliability of the trial subject. So they should manage a quality management. What's the quality management? That's the design of efficient clinical trial protocols. Protocol is a roadmap of any clinical study, and tools and the procedures of the data collection and the processing, as well as the collection of the information, is the quality of management. The sponsors will ensure that all aspects of the trial are opportunely feasible, and should avoid the unnecessary complexity, procedure, and data collection. Like the match. This is our research team, but the player. And this is our institute ethics committee, who take the decision every moment when the match is going on. First umpire, second umpire, third umpire. Sponsors. There is the main pivot of the role. They are sponsoring the whole sponsor for the match. And these are the regulators. Here is the BCCI, but in our case is DCGI, Director Control General of India. So the key players of a clinical trial is a lot. The investigator, the CRA, the patient, the ethics committee, the regulator trial, but the main pillar is the sponsor. So there are so many roles of the sponsors. We are coming one by one. The critical process and the data identifications. Suppose we are doing one hypoglycemic drug trial. So the chances of hypoglycemic drug trial is hypoglycemia, like anti-diabetic agent. So that's every time there is a chances of hypoglycemia. So this is the risk. So we have to know what is the risk before entering the trial. So we have to identify that this is the drug. We are comparing with some metformin and dipeptide, and also so we are adding some other drug, Ghosh, and we are comparing these two drugs and three drugs. So in that case, the first thing is we have to identify that there is a chances of hypoglycemia much more. The risk identifications. And then we have to evaluate it. How to control? The risk control. And we have to percolate the informations to the others. That is risk communications. And the risk review. So we have to follow some design. What design? Particularly in case of anti-diabetic drug, we follow the 15-15 rule. 15-15 rule means every 15 minutes we have to check or any sort of hypoglycemia is there, the 15 gram of glucose should be taken. So this is the guidelines, the risk review, and then we have to report it. So the critical process and the data identifications is a prime role of the sponsor. The sponsor has to think fast before doing the protocol. So from the predefined quality tolerance limit and immediate action taken in the clinical trial report is a fast work for the sponsor. Second, there's a quality assurance and the quality control. The sponsor is responsible for the implementing, the maintaining the quality assurance and quality control. Everything is good, but the quality is not controlled. The machine is not up to date. There is no SOPs in every step. So all the result is in nothing, zero. So in every step, we have to follow the SOP. We are taking the blood pressure. So blood pressure, we have to follow the rule. There should be SOPs how to measure the blood pressure. We have to follow the rule how to take the drug and what time. We have to follow the rule in what time we do the test. So every written SOP in every trial to be conducted. The data generated should be based on the SOP, the documented, recorded, every step there should be some SOPs. And that should be written in the protocol. And this is our good clinical practice. So quality control should be applied in each stage of the data handling, ensuring that all data are reliable and processed correctly. So sponsor is responsible to securing the agreement and from the all involved parties, like the blood test to be done on NABL lab. So there should be some contract with the agreement with that NABL lab with the sponsor. So the transportation will be done some cold chain maintaining. The cold chain maintaining transport, there should be an agreement that every quality control should be with some data logger, that the temperature will always be perfect. So that's every step the controlled by our sponsor. So what is quality control and quality assurance? So our trials should not, it is not ensured that our data is 100% error free. We are the biological body. Every time there is some error. But the thing is that we have to think the data should be real and data should be unbiased. So the reliable data. In case of quality control and quality assurance is always preventive measure. We have to prevent. How to prevent is the quality assurance. But quality control is some verification to see the defect. So quality control is the verification process. It is done by the scientist. On the other hand, quality assurance is done by the management team, and it is a preventive process. Third, contract research organization. If somebody is doing a study in Bengaluru, this is the sponsor is staying at the Bengaluru, but as per rule of our clinical trial, there should be multi-center trial. So one trial in our Midnapore Medical College. The Midnapore Medical College, the trial is there. So one person from the Bengaluru is not possible to see or to monitor the trial at the Midnapore Medical College. So they should hire some CRO. That is, CRO is at our Kolkata. So Kolkata CRO will control that with our Midnapore Medical College. And that result will be, they will send to our sponsored at Bengaluru. So the CRO, there is some contact with the CRO and the sponsored. But the responsibility is both. And the ultimate responsibility goes to our sponsored. So the CRO also implement to do quality assurance and quality control. So what is the role of the sponsor and CRO? Feasibility studies. They will send a form. Suppose we are doing one study on allergic rhinitis in the ENT department. So they will send a form. How many patients in a week of allergic rhinitis? What the drug you treating it? What is the patient flow in the ENT department throughout the year? Out of them, in which season this patient is going on? So by this result, they can assess this child is feasible or not. There is feasibility of study. This is done by the CRO and the sponsor. Site identification. They choose the site. Which site is possible? They will come and see. ICF design, informed consent form design. If this is a Bengali region, so there should be some Bengali form. If there is some Hindi, So they should translate in Hindi. Recruitment strategies, how we recruit it. Okay, if somebody is giving time at Assam at 8 a.m., it's correct. But if we give the same time 8 a.m. at Mumbai, it's not possible. So the recruitment strategy is what time the patient will come. You have to mention it. IRB and ISC submissions, document translations, contract and budgeting negotiation, patient recruitment and retention, subject safety management, medical writing, and call center. To time to call the patient, she is okay or not, he is taking the drug or not, she put down all the data in his notebook or not. You have to follow it. So there should be some call center. SMO. As I have just mentioned you, the CRO at Kolkata, sponsored at Bengaluru. But what about our Midnapore? So Midnapore should want SMO, Site Management Organization. SMO will conduct the trial as Site Management Organization. They monitor the every time at the Midnapore, the situation, they situated at the Midnapore, and they do the all sort of information, data, everything to our sponsor, to our CRO. Medical expertise. The sponsor should designate appropriately the qualified medical personnel who will be readily available to advise the trial-related medical question or problem. Any issue may become. During this the blood pressure of some hypertensive study, after giving the dose as assigned to the patient, the blood pressure is not decreasing. For the last 2 weeks, blood pressure in the same state, in the same range. So what to do? Now the medical expertise told you can exclude this patient from the trial and give him the rescue drug. That is some veterinary drug with some physician that can patient safe. If the persistently high blood pressure for more than 10 days, it is not good for health. There may be some CVA. So he can exclude the patient from the trial. Trial design. According to the design. So the sponsor can utilize the qualified individual like biostatistics, clinical pharmacologist, physician, as appropriate through the all stages of the trial process for designing the protocol, the CRF, that is clinical report form, and everything to be analyzed throughout the by the help of data management, data handling, and record keeping systems. This is the various trial our HOD said. This is the some sort of trial design, the PRISM 1, PRISM 2. This is another trial design, the double blind open label. So many trial design can be done. Now come to the supervise the clinical trial. Sponsored is supervise the clinical trial. And every time, the sponsors utilize the appropriately qualified individual to supervise the overall conduct of the trial. Particularly those who are working as a clinical pharmacologist, we act as a monitoring of the clinical trial. We go to this particularly site and we monitor the every step. And this is a new job for the clinical pharmacologist to supervise our clinical trial. But if there is any deviation from their protocol or not. And there's another department has been evolved that is called Independent Data Monitoring Committee. They also assess by online, they check every time if the trial is going as per protocol or not. So somebody is using the electronic trial data system. So in that case, the sponsor should ensure the document of the electronic data process system confers the completeness, accuracy, reliability, and consistency, intended performance. That is, every step should be validated. The maintaining the SOP. At what time there should be some antivirus should be used that cannot access access from defined site because it is electronic trial data. The SOP should be covered as the setup, installation, which company will be used, what is the RAM, everything will be details in the SOP. There should be maintain some audit trail. There should be maintain some data trail. They should maintain the edit trail. So any change. Today we are using BP is 150 by 90. Tomorrow I think if I am right 150 by 90, the patient will be excluded from the trial. So cut down, the BP will be 130 by 80. But as because any trial is there, immediately the sponsor will realize that there is a change. So they can diagnose there is something is fishy. So there is a security system to prevent the unauthorized access. There should be a list of individuals who can authorize and to make the data changes. Everybody cannot change. There is some authorized person who can know the password and they can power to change the data. Safeguarding blinding. There should be blinding. And ensure the integrity and data every step. Investigator selection. Who will be the investigator? Anybody cannot be investigator. They should go through. There is some protocol. The sponsor is responsible for selection of the investigator and also the institutions. So the sponsor should obtain the investigator. Some agreement is there. You have to, at first you have to sign the agreement. Then they can give you the information what trial will be done. In the beginning, they will say one anti-diabetic agent will be tried. So at first you sign it. Then after signature and go through your data like this, your degree, your paper publication and everything, and then they will give you your what will be the drug, what will be the patient, everything they will give the information after doing the agreement. So to conduct the trial and compliance with GCP, the applicable regulatory requirements and the protocol agreed by the sponsor given or approval by IEC or IRB to comply the procedure and data recording and reporting, to permit the monitoring, auditing and inspection, to retain the trial-related essential document. So the sponsor and the investigator institution will sign the protocol also confirm the agreement. So how they can select the investigator? So marketing department is there. That marketing department will give, I want to do one anti-diabetic agent, give some doctors from Kolkata. So they will give you 3 or 4 names. And for these names, they will take money. This is the marketing department is now for the data. So this is the, because that doctors are popular, so they can manage. So they are doing some organization, site management organization. Literature review. People seeing the particular endocrinologist, they are publishing a lot with some anti-diabetic agent. So that means he is doing the various trial, academic, whatever maybe. So this literature review, another source where can select the investigator. Medical society director. From the medical society, like your IP, your IPGs, there are so many organizations there. From there they can select it. Reference from the investigator. One investigator give the name of another friend. That's here. Also pretended to be the study. So give that phone number and everything. Now they can collect themselves. Professional colleges. Again, clinical trial registry. Every trial, what it may be. It may be academic, non-academic, any human-related trial. You have to register in our CTRI. So clinical trial registry, you can find out the name of the investigator. Allocation of the responsibility. What will be the duties for every staff who are within the area of clinical trial? So there is some allocation of the responsibility for each staff. Again, there is the SOP. Compensation and subject investigator. There will lot of discussion on compensation. But thing is that ultimately the compensation to be given by the sponsor only after the investigator and other shared or authorities. Financing. Every finance done by our sponsor. Notification, submission, regulatory authorities, every step from our central agency up to the institutional ethics committee, even if there is some special condition, every step, every penny should be sponsored by the sponsored. Confirmation from the IRB and IC. Again, like in Midnapore Medical College, I am doing one study. So I have to go to the SOP of the Midnapore Medical College. What is the money to be given if somebody from phase 3 trial will be done? So in particularly in our Midnapore Medical College, 30,000 you have to pay to the ethics committee to do any clinical trial phase 3. So if you pay the 30,000 and then you give all the documentation, after that the ethics committee will consider if this particular trial is feasible or not. If feasible, they will approve. If not feasible, at that moment, it needs some correction, so they will give some favorable opinion. Information of the investigational product. Professor Haida has told there is IB, that is investigation brochure. So if we want to do one phase 3 clinical trial in Midnapore Medical College, so we have to jot down the all information from the preclinical and the clinical phase 1, clinical phase 2, every bits of the information, adverse effect, where the drug has been used, who is our every details information should be kept in our investigation procedures. So that should be provided by the sponsor to the investigator, and anyone, if our ethics committee wants the information, they have to provide it. Manufacturing. From the manufacturing the drug, packaging, labeling, coding of the institutional product, everything should be done by our sponsor. Like as we know, RU486. RU481 drug in gynecological used, that is mifepristone. So this is the coding, RU486. RU means the Russell Wood Crop is a company. So RU. And 486, this product is their investigational product of 38,486. Because 38.485 has been abolished. That is not working. The 38,486 is the functioning one. That is the mifepristone. So that's why they're given the name of 486, RM486. So this is the coding. Supplying and handling the investigational product. They have to supply it. And also handling the investigation product, there's only goes to our sponsor. So the product shipment, product receipt, product deposition, product return, everything should be done by our sponsor. Record access. After the experiment, going on the experiment, everything record should be kept in properly. Even after the experiment, after 5 years, they should be preserve all records. Now there are so many companies who are archiving all sort of clinical data reports, even the electronic hard disks they are keeping. Safety information. Every step, the safety information should be given to all health providers. Everything reporting. This also again from the sponsor's end. Monitoring. Every time the monitoring should be done by the sponsor. There are so many parts in our. So mainly, main motto is that the accurate, complete, and verifiable source document. How they monitor? Monitor is appointed by the sponsor. Monitor responsibility is to take unbiasedness. Though the sponsor is hiring him, but she or he always do is as a unbiasedness. Auditing. After the whole procedure, audit should be done. How many expenditure has been done from the protocol to the ultimate, the submission of the report. Non-compliance. Every non-compliance should be monitored from the SOP, from the protocol, from the GCP, from the regulatory requirement. Everything should be considered, and that should be monitored by our sponsor. Premature termination or suspension of the trial. If the trial result is very much in the interim analysis or found that this drug is good, so we can prematurely terminate the product. On the other hand, if there is so many adverse effects, there's so many death is there, at that time investigator or the sponsor can take the step to prematurely terminate the product, this trial, or even suspension. Particularly IC recommended that there is the dose is much more, there is more toxic. So please suspend the trial now. You consider again to tailor the dose to come again for the study. Clinical trial and the study report. At the end of the trial, it may be prematurely or may be complete trial. You should submit the report. This is again the burden of our sponsor. Multi-centric trial. If there is so many multi-centric trial is there, so every center should be monitored and everything should be done by our sponsor through the CRO and CMO, SMO. This is an example of the multi-centric trial. So, sponsor is doing the clinical investigator, clinical pharmacologist, he is the institution selector, he is the independent data monitoring committee, he is a statistician, CRO, auditor, medical monitor. Everything should be done by the sponsor. This is the key stakeholder. Thanks.